Nija ma'am, we are live streaming the program as well on the YouTube.
Yeah.
So one of my colleague will be reading the queries from the YouTube, and I'll be taking the queries from the Google Meet itself. I have with me Dr. Gurvinder Kaur. She is the Chief Coordinator, Convener, Skill Development Committee of our college. Miss Shabnam, lots of our students like Pratiksha, Amreen, Pritika, so many students are helping in this. And Dr. Preeti is also there, who is handling the YouTube live streaming. So we have the whole team with us and taking care. Still, we are receiving so many queries that we want to enter into the Google Meet only, but we have limited capacity of 100 people only here.
Yeah.
And I would like to tell you that more than 1800 people have joined.
Oh, cool. That's
Yeah,
nice.
yes, ma'am. They have
And
registered,
yeah.
and because of the facility that the lecture is available on the YouTube channel, so they can, watch it later on also as per their convenience,
Yeah.
and they can see the repeated video also, so that in case of anything they missed it due to network issues, they may have a recapitulation of all the concepts discussed.
Yeah.
And
And
it's
you'll be recording it for me also.
Yes, ma'am. I'll be sending the recording to you.
Okay. And what is the main audience? It's also
Ma'am, audience, we have the faculty, professional students all over, not only from India, but from almost all the continents except Antarctica.
how did you manage such a wide reach?
So, professionals are there from all the continents.
Hi, Gurvinder. Gurvinder is muted.
Good afternoon.
Yeah.
Sorry, I was muted. I didn't realize.
कोई गल नहीं. So cool.
Though a formal thanks will be on the way, ma'am, but I must take this opportunity to thank the doctors. Right now, you are the real, I would say, the heroes throughout the world, and the way you people are taking care, I mean, no words for it. So just accept our humble gratitude, and I think I can say it on behalf of the college also, and perhaps on the behalf of all the participants here. Yeah, so it's very humbling to be in the presence of doctors.
Yeah, I think doctors are doing a great job. It's the whole team. It's all the paramedical.
Ma'am, I'm
Yes.
audible.
Yes.
I got disconnected. My Wi-Fi stopped working.
Yeah,
I
yeah.
am joining through the hotspot now.
Okay. All right. We can hear you.
Okay, thank you. Yeah, ma'am, you may please continue the interaction. I was just
Yeah.
confirming. Thank
I
you.
was just saying that it's the entire team, but the brunt of anything going wrong is on doctors. Like you don't have oxygen, they will beat up the doctor. And not many people realize that there are things that we are meant to do, and that is to treat. But we are not there to provide the provisions or the infrastructure. That is not our field, that is the field of administrators, government. But the police and the administration is also doing a great job. I have a great admiration for police and army people, anybody in uniform for that matter.
Yes, in fact, I'm from the field of administration. I'm teaching public administration and have been following closely whatever our I would say such a huge country, and yes, we are facing problem. There have been some decisions which could have been better, but yes, all the frontline workers, they are providing us, and doctors, I say, especially because you are right there next to the patients, and
Yes.
I think that requires a lot of courage. हम लोग घर बैठ के या कोई न्यूज़ पढ़ के कभी कभी घबरा जाते हैं, but the people who are there with the patients, dealing with them, not just their body but their mind also.
Yeah.
It requires a lot of
Yeah.
courage and toughness.
That is why they are called frontline warriors.
Yes, frontline warriors.
Yeah, very true.
Meenakshi, will ma'am be joining us today?
Ma'am, no information yet. I have shared the link with her, so I think in case she get time, she is going to join in between.
All right, all right. A little request to all the participants. So there, since you would have a lot of questions, and we would like that most of the questions are answered. So both me and Dr. Meenakshi, we will just try to go through the questions simultaneously as they appear, and we would club the similar questions so that maximum of the questions can be answered. So please don't mind, because sometimes the questions are so similar that it's difficult for the person also to answer, and then in that scenario some people may not be answered at all. So we would be just clubbing together similar questions and putting it to Dr. Nitya.
Ma'am, we have a poem written by our principal, worthy principal, Dr. Nisha Bhargava, on the occasion of Mother's Day. However, every day belongs to mother only, but she has written it specially on the occasion. So I would like to share with our audience today, just for the sake of positivity, and I just want to share her words of wisdom. It's so inspirational, so touching. So I would like to just read it out on behalf of her. And it's a blissful composition, so you will be enjoying. Let me read it out. इन मैम वर्ड्स ओनली. वैसे तो हमारे लिए, एंड आई एम रियली अपोलोजाइजिंग टू द पीपल हु आर ज्वाइनिंग अस फ्रॉम डिफरेंट कंट्रीज. दिस पोएम इज रिटन इन हिंदी ओनली, सो मे बी यू अंडरस्टैंड सम वर्ड्स. वैसे तो हमारे लिए हर दिन माँ का होता है, लेकिन
Meenakshi, before you continue, can I translate side by side so that they can understand?
Ma'am, let me finish it. You can translate all like the whole
Right.
composition in English. I think you are very much able to do that.
All right, all right.
Okay, okay. वैसे तो हमारे लिए हर दिन माँ का होता है, लेकिन पाश्चात्य सभ्यता के प्रभाव में आज हम मातृ दिवस मना रहे हैं. इसीलिए सभी आदर्श माँओं को मेरा साधुवाद एवं अभिनंदन. माँ के लिए एक कविता उन्होंने लिखी है जो प्रस्तुत है. मेरी माँ, इसका शीर्षक है मेरी माँ. जिसके दिल की मोहब्बत उसकी आंखों में रवां थी, वैसा और कोई नहीं जैसी मेरी माँ थी. मेरे हर दुख को अपने दिल में समा लेती थी. मैं कभी रूठ जाऊं तो मुझे झट से मना लेती थी. मैं जो चाहती थी वो हर बात मान लेती थी. बिना कहे मेरे दिल का राज जान लेती थी. जो मैं उनसे कहती थी किसी और से कहना नहीं आया. अब तक मुझे उनके बिना रहना नहीं आया. उसी ने जन्म दिया और जीना सिखाया मुझको. मैं जो भी हूँ उसी ने बनाया मुझे. ढूंढती रहती हूँ मैं उसको खोए हुए नज़ारों में. ढूंढती रहती हूँ मैं उसको खोए हुए नज़ारों में. शायद वो रहती है कहीं आसमां के सितारों में. वो एक फूल थी जो मुरझा के फिर न खिली. बहुत रिश्ते मिले दुनिया में, माँ मुझे तू फिर न मिली. बहुत रिश्ते मिले दुनिया में, माँ मुझे तू फिर न मिली. In the words of Nisha Bhargav. Thank you so much, ma'am. We are truly blessed to have this composition with us. Thank you so much. Over to you, Gurvinder ma'am. However, it's quite difficult to translate so little time, but I just request if you can say a few words.
Yeah, Meenakshi, I think we can now perhaps first begin with the session because I can see, at least in the chat, many questions have started already
Yes,
coming.
ma'am. Sure,
So we
sure,
would
ma'am.
like
Sure.
to have more time for answering the people so that Dr. Neecha
Yes,
can.
ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. So I extend a warm welcome to all the participants present here, and we are feeling extremely grateful, honored that people across the world have joined us in these challenging times. I welcome you on the online portal of Be a Health Manager 2021, the annual 7-day workshop series organized by Meherchand Mahajan, DAV College for Women, Sector 36A, Chandigarh. It lies in the heart of City Beautiful Chandigarh. And I wish that this blissful journey of learning and growing together continue like this forever. I would like to invite now Dr. Gurvinder Kaur, the convener Skill Development Committee, to extend a warm welcome to our guest for today, Dr. Gurvinder.
Thank you, Dr. Meenakshi. So we are all here to welcome Dr. Neecha Chawla. She is an MD from Delhi, and she has done diploma endoscopic surgery, New York, USA. A gold medalist, she has several distinctions to her credit. She is former consultant, Department of Gynecologist, PGI MER Chandigarh. She is Vice President, FOCSI Northern Region, Chairperson, Digital Education Committee, Indian Menopause Society, ex-president and founder convener, Chandigarh Gynecologist Society, President and Founder Secretary, Indian Menopause Society, Chandigarh Chapter, Founder, Life Member of Indian Society of Minimal Access and Gynae Endoscopic Surgery, Director, Gynae Infertility, Minimal Access Surgery, Gynae Endoscopy Center, Chandigarh. She has passion for and is one of the pioneers of endoscopic surgery in this region, and she has a lot of interest in the issues related to infertility and menopausal medicine. We welcome you, Dr. Nirja, and over to you now.
Thank, thank you, everyone, and a very great good afternoon to everyone. If Pratiksha can allow me now to share my
Yes,
screen.
ma'am. Sure, sure, ma'am. Sure.
So I wish to thank Dr. Nisha Bhargav, the principal, and Dr. Gurvinder Kaur, the chief coordinator, Dr. Meenakshi Rana, who is the coordinator, and of MCM DAV College. And I am grateful to you for inviting me here for this third series. This is your third series of the 7-day annual workshop on healthy living and better lifestyle, and Be a Health Manager 2021. So today I'm going to speak on PCOS. Now, everybody, as far as I know, is using this word as such. They are calling it PCOS. We are here to understand in very simple and basic terminology what exactly this is. So, yes. So, PCOS is what is the common terminology that we use nowadays. Originally, it was called PCOD, where D stood for disease. So we no longer call it a disease, we call it a syndrome. P stands for poly, which means many. C, cystic, fluid-filled structures in the ovary, syndrome. A syndrome is a wide spectrum of symptoms and signs which are involving different organs. So it's not a disease of one particular organ. it's a syndrome. And why we are discussing it here in healthy living, it's because, see, more than 20% of it is occurring in this reproductive or younger age groups. I would say that the number of patients coming to our OPD and any OPD which is dealing in gynae endocrinology is this figure is much, much higher. 60% of the PCOS is in teenage girls. Now, what is symptom? Symptom is something that the patient notices or feels. For example, so you say, I have a headache. That is a symptom. Sign is something which the doctor sees or finds. For example, the doctor might say, oh, you have a liver enlargement. So that is a sign. So now we are going to have a look at the common symptoms and signs of polycystic ovarian syndrome. One of the most common is a delayed irregular period. What is the definition? How do you know your period is delayed? See, the normal cycle is 28 plus minus 7 days, 21 to 35 days. If within that range your periods are coming, so that is a normal one. Anything more than 35 days interval is delayed. Usually 11 cycles or menstrual periods in 1 year is the norm. If it is less than 8, it is a delayed cycles. Or if there is no period for a gap of 4 months. So this is a definition, what is delayed. What is regular? You have a cycle which comes 31 days and it regularly comes at 31 days. Or you have a cycle which you don't know when it will come next. So regular cycles are plus minus 2 days of your normal cycle. Anything more than that, and usually more than 20 days, is irregular. Another symptom is that the period may be prolonged. If the period lasts for more than 7 days, then by definition, this is called a heavy period. And this is quite the norm with PCOS. Then we have obesity and overweight. We will come to this in a short while. We will go a little bit more in detail of this. Then we have androgen excess. Androgen is the male hormones. So we must understand that everybody has female and male hormones. The female will have more of female, less of male, and the male will have more of male and less of female. But we all have all the hormones. If a female has a predominance of male hormones, so that is a feature of PCOS. So what are these features of male hormones in a female? So you have facial hair in the mustache or in the beard area or the front of the chest or lower abdomen, medial sides of the thighs. These are all male patterns. Then the pubic hair. The female pattern is like a triangle, like this. But the male pattern is like a triangle with the apex going towards a straight line going towards the navel or the belly button. So hair in this area is a male feature. So somebody can have some features, some not, but even if 1 or 2 features are there, they are male features. Female skins are very smooth, but male skins are acneiform and oily. There could be frontal balding. And the trunk. Trunk is the middle part of the body. See, females have an hourglass figure, but if this trunk is straight or if the midsection is bulging out or fat, it's a male feature. Many of PCOS present to us as infertility. Ma'am, I can't conceive. And then you find that the reason for her not able to conceive is PCOS. Then we have thick black velvety skin in body creases. This is so common, and you will find that, just a minute. I want to put this full screen. I'm not able to get my arrow. Yeah, I got it. Sorry about that. So this is called acanthosis nigricans. You can always check. See, this is the nape of the neck. This is the underarm. This is a hyperpigmented areas, which is pre-diabetic. So anybody who has this, then just be alert that either there is already a diabetes or it is going to come. Now we must talk a little bit about overweight and obesity. Whatever your weight for height, you have so many diaries and charts where you can check for your height what is a normal weight. If it is 10% more for that, it is overweight. If it's 20% more, it is obese. Now, in my own clinic, we very rapidly do this by an approximation. And what I do generally is that if my patient is 5 feet 3 inches, I say she should be approximately 53 kilograms, and 10% increases add 5.3. And if she's more than 58.5, she's overweight. If it's 20% increase and she's more than 63.6, this is overweight and this is obese. 10% is overweight, 20 is obese. Another way to do it by using the Broca index, your height in centimeters minus 100 is a weight in kilograms. This is for males. 10% reduce it, and that would be the normal weight for height in a female. Body mass index is actually a gross estimate of the fat in the body, Quatlet index. You can actually calculate it by doing weight in kilograms divided by height in meters square. And you can have these various values for this. I'm not going to read this. What I want to point out to you is that in India, the overweight value is more than 23 BMI and obese is more than 25. Why are these two values lower than in the Western world? Because our research has found that even at lower weights and lower BMI, Indian populations and Asian Indians and Asians for that matter, they have a similar rate of complications or problems as with higher BMI in the Western world. Now, weight is one issue and body mass index is one issue. One thing that I want to bring to your notice is about fat. We talk about fat. The overall fat is actually two types. One is the subcutaneous fat, which is under the skin, and one fat is which is inside surrounding the liver and the pancreas and the intestines. This is known as visceral fat because all these internal organs are called viscera. Now, it is this visceral fat which is the culprit because it is metabolically more active. What does that mean? It means that there is higher chances of having insulin problems and diabetes and lipid and blood pressures, higher the visceral fat. Now, how can you find out how much visceral fat does a person have? You can do it indirectly by doing an MRI, or you can do a waist circumference. By this, you get a size of the waist. Now, 10% of the total fat will be visceral fat. So if a person is fat, then remember that her visceral fat will also be much more. The standards for women is waist circumference, it should be less than 80 centimeters, and waist hip ratio should be less than 0.81. Now here I have written apple shaped. Understand the concept of this apple shape. Apple is the central part or the mid part of the trunk. If this is ballooned out like this, it's like an apple. This is the highest risk for complications in the people. Then we have, on the other hand, we have what is called as pear-shaped. Pear-shaped is like this, that the hips, the buttocks, the thighs, they are fat. You will notice that it is actually women who are pear-shaped, and this has been taken as a sign of great fertility. But if a person is obese, then if she has more weight, whether she's apple-shaped or pear-shaped, it doesn't matter. That she is obese, that matters. And why is overweight and obesity so important for us in today's discussion is that 70 to 80% of the PCOS patients are overweight or obese. I've made this a little line diagram, and I can assure you that even young patients as young as 14 years of age are able to understand this. It is so important. It's an understanding of you yourself. Now look, the first day of the period is known as day 1. In a normal 28-day cycle, This will be day 28 or the day 1 of next cycle. At the center of it is the release of the egg. This is around day 12 to 14. The time period from this release of the egg to this period, which is going to come, is fixed at 14 days. Now, if this egg release is delayed by, say, 1 week, then this period which is going to come will be delayed by 1 week. If this is delayed by 2 weeks, this will be delayed by 2 weeks. And if this egg release doesn't happen at all, then when will the next period come? It'll come here, 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 or even statistically here, which means it's a delayed and irregular cycle. So delayed and irregular cycles are controlled by the ovulation. Have a look here. The first part of the menstrual cycle, the hormone is estrogen. Don't learn this, you don't have to, just flow with my voice. So the first half of the cycle, you have a hormone estrogen. And once the egg is released, the hormone produces progesterone. But if egg release has not happened, then this progesterone is not produced. If estrogen is acting like this, progesterone is acting like this, it is balancing it. But you remove the progesterone, the patient will become estrogen dominant. And why do we have a problem with estrogen dominance is that it acts directly on the uterus and thickens the lining of the uterus. There is no progesterone to counteract its effect, so the lining of the uterus becomes thick and the patient will have very heavy periods. So that is the impact of this on the uterus. So here you can see a magnified view of the ovary. This follicle which contains this egg is growing, 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 and then this egg is released. It is picked up by the tube, by the fimbrial end of the tube, and it goes to the uterus. And after the release of this egg, this will close down, and at this point, the hormone produces estrogen, and then the hormone produced is progesterone. In a very simplistic way, if this egg release doesn't occur, then all the follicles you will see at the periphery or the outer surface of the ovary. This is actually a simplistic view. Actually, there is an arrested development of the follicles, and this string of pearls appearance is very classical of the picture on ultrasound in PCOS. So just saying there are cysts in the ovary, it's not important. If it is, these cysts are like strings of pearls, then that is PCOS. So now we are wanting to look at is, why is ovulation delayed or absent, because of which the period is delayed. So you have excessive eating, excessive fasting, excessive weight gain, excessive weight loss, excessive exercise, excessive no exercise. Even though my grammar is incorrect, I'm continuously using the word excessive to highlight the fact that it is this excessive of anything, whether you eat or fast, which will cause delay in the period. You need to do everything in moderation. In fact, even your exercise should be in moderation and don't go overboard. And you saw that PCOS is in the younger age groups. So if there's a delayed period, don't miss. If you are sexually active, this is the first thing, pregnancy, that you should rule out. Don't think of PCOS straight away. Then the other causes of this delayed egg release is hormonal, stress, and obesity. A little bit more facts about obesity. See, the fat which is there under our skin, it actually acts like a factory. It changes the male hormones to the female and the female hormones from inactive to active, active to inactive. Now, if the fat under the skin becomes a little bit more than the threshold, then this factory gets disturbed. That is why there is difficulty in egg release or a delayed period. Now, all these factors are interconnected. Must remember that all these hormones are interconnected. They are not independent of each other. So if there is a problem in the egg release and the cycles, they are connected to everything else. Just look at the lobe of the brain, which are directly connected to stress. So you are controlling your polycystic ovarian syndrome. This is very important concept to understand. So who are the people who are at more risk? Those who have a family history of polycystic ovarian syndrome. And remember that it is not just the mother. Girls who have very, very hairy fathers. So those fathers are more likely to have daughters who have PCOS. Then this is a combination not only of your genes, but your metabolism and inflammatory processes caused by certain hormones. At this point of time, you must understand a little bit about insulin, because we all are very intelligent people and we need to understand these issues to take control of ourselves. See, insulin is the hormone which is responsible for pushing the glucose from the blood inside the cells. But if there is an insulin resistance, this insulin cannot act, and this glucose remains inside the blood vessels. So patients have diabetes or high blood sugars, and because this insulin is not able to act, insulin itself, the body produces more and more of insulin. So there is hyper levels of sugars and hyper levels of insulin, and insulin is the one which drives the male hormones, and all this is connected to obesity. So when do we say that a person has polycystic ovarian syndrome? There are many, many definitions of it, but what we generally follow in our OPD is the Rotterdam criteria, which says 2 out of these 3. So a delayed period, excess of male features, and polycystic ovaries on ultrasound. Any 2 of these, and that patient is diagnosed with a label PCOS. So what is it that we do? Don't get frightened by all these things. We do very simple clinical examination, anthropometry, measuring heights, weights, blood pressures, and things like that. And very simple checking of acanthosis nigricans at the nape of the neck, any male features of the hair, and whether there's breast discharge, because prolactin responsible for the breast discharge is coming from the pituitary. So we are trying to identify which of the various that spectrum of hormonal glands are involved. And the tests are very simple. And some of these advanced tests we do in special cases, like there is excessive hair or a patient wants pregnancy, then we want to check whether her ovarian reserve is good enough. So these are special tests. And why should you treat PCOS? See, in the 80s, we used to say, this is actually true. We actually used to tell people that as long as you don't want to have a pregnancy, there is no need to treat it. But this is not so anymore. We have sufficient research now to say that whether or not a patient, suppose you have a 14-year-old, she doesn't want a pregnancy at that age, but she still needs a treatment, because metabolic syndrome is double of normal in PCOS patients. And what is metabolic syndrome? Metabolic syndrome is a cluster of problems which I have listed here and which I will enumerate for you. It's a cluster of problems which a combination of 3 out of 5 of these makes a person at higher risk of heart diseases, heart attacks, and angina. So this cluster of problems is higher incidence of diabetes, higher blood pressure, which is found in 10 to 40% of PCOS patients, higher lipid abnormalities, low HDL and high triglycerides, and obesity. So in this cluster of abnormalities, this is double that of normal. Now, you might have a question that we talk of obesity and overweight. What about those PCOS girls who are by definition Rotterdam criteria? They are PCOS, but they are not obese. Those are called as the lean PCOS. And see, the critical factors of PCOS is obesity, number 1, and insulin resistance. Out of these 2, the primary factor is insulin resistance. So even if the girl is not obese, but she has insulin resistance, they too are at higher risks of all these cardiometabolic complications of PCOS. So even lean PCOS will require a treatment. Some of the complications, if you do not treat, is fatty liver, which in certain instances will land up in years to come, but it will in liver cancer, and difficulty in sleeping, depressions, anxiety, excessive bleeding. Later on, cancers of, I told you, estrogen causes thickening of the lining of the uterus, and you don't have progesterone to protect it. So the cancers of the lining of the uterus are common, as well as some complications in pregnancy. So don't ignore PCOS, because you can prevent the complications and you can reverse the symptoms. So then what is the treatment? There is no treatment, there is no cure. Actually, that is the correct word. What do you mean by cure? You have a boil here and you go to the doctor and antibiotics, anti-inflammatory, everything, drainage, everything is done. The boil disappears. You have been cured. But PCOS, you cannot cure. What can you do? So you cannot say that I'm taking these medicines for 2 years and I'm still not okay. When I stop, then I get the same thing, because underlying you are PCOS. What you can do is you can just do relief of your symptoms and prevent complications. So look at this. Obesity, we understand, has caused problems in release of the egg. That is why there is delayed periods. Naturally, there is no egg, so there will be difficulty in conceiving, and there are male features. And I have made this as a cycle. It perpetuates itself. More of this, more of this, more of this, more of this, and it goes on and on and on. So how are we going to manage it? You cannot cure it, but we can manage it. So if the doctor will ask, do you want a pregnancy? So the patient says yes. Then you give her medicines to release her egg. The patient says, no, I'm just 14 or I'm married and I want to have pregnancy after 3 years. I just cure my delayed periods. So you give her medicines to solve her delayed periods. And if she says, oh, I only have excessive hair, can you help me with that? So depending upon what symptoms are there, you are going to treat according to that. But the backbone of all this is lifestyle modifications and management of obesity, because your doctor will help you with this, but you have to help yourself with this. If you can break 1 or 2 links in this chain, then this entire thing can reverse by itself. And if the patient wants a pregnancy, so you can help her in that. Delayed periods, the treatment or the management is with oral contraceptive pills, which have great advantages. And if there is problem in infertility, you must treat the associated conditions and male features also. So we come to this point that the key to the management of PCOS is lifestyle modification. That is the first thing to do. It is superior to any drug alone. So first you do that. If you're not able to solve it, then you go on to medicines. But if you are on certain medicines, you will need to add lifestyle modifications to that. Now there are 2 ways that we go about these lifestyle modifications in PCOS, and one is weight loss and one is stress management. As far as weight loss is concerned, how much? So the answer is just small amount, 5% of whatever you are at this moment of time. You are 70 kilograms and 5% is 3.5 kilograms. So reduce only that. These are achievable targets. Once you have achieved that, then you try and make your weight 10 to 20% of whatever you were and maintain it at that. How? One way to do is this we call as DCR, decreased calorie reductions. So 500 calories per day, if you decrease, you calculate from the internet how much you are taking in a day. See where you can reduce 500 calories. If you just do this, then 1 kilogram of weight loss happens in 17 days. Smaller plates, smaller portions, no second helpings. We have a lot of questions about special diets. keto diet, modified Atkins diet, paleo diet, Newcastle diet, Mediterranean diet, what we found was that none of these diets are superior to intermittent fasting, which can be done in several ways. One is alternate day fast, where you can do 4-3, you fast for 4 and you eat for 3, or you can do 5-2. You can do modified alternate day fasting. That means on the day you're fasting, you can take 500 calories, but on only if you're following the modified alternate day fast. You can do one meal a day. That is also a way of intermittent fasting. Or the best method is time restricted feeding, which you can fast for 14 hours and eat for 10 hours. That is something you can begin with. But the best is to do 16-18. So you fast for 16 hours. So suppose you have had your dinner. Now, the very important part of this is that most of us actually will fast in the morning hours. I want to warn you against that, because this works only if the fasting is in the late evening at night and night. So if you have had your last meal at sundown, say around 6 o'clock, so by 8 o'clock next morning, you have already covered 14 hours of fasting. So you can eat. Or 10 o'clock if you eat, then you have made it 16 hours of fasting. But in those durations when you are feeding, you can eat n number of calories. You don't have to restrict on your calorie intake during your feeding time. More details of this, I would recommend that you go to my own talk on YouTube under my name. And the same talk has been uploaded on the official channel of the Indian Menopause Society. Check it out, because you will get some information on how to decrease your weight. Then another way is to change your diet, take more of complex carbohydrates, more of fiber. And one way, I have underlined this, because what we have done is change the macronutrients, decrease the carbohydrates, increase the protein from 15 to 20. Fat remains the same, because you need a certain satiety level, and you cannot eliminate fats because there are so many fat-soluble vitamins that you need. Diet is the most important component of weight loss programs. 80% of your weight loss should be focused on diet. 20% by exercise. You cannot exercise out of a large, unhealthy American-style diet. So exercise alone will not work. When you do exercise alone, weight loss is less. So combine both. But weight loss, exercise will help you in insulin resistance and improve reproductive outcomes. Which exercise? So you have aerobic, which is cardio or endurance. And if you combine this with resistance exercises, that is working best, not this alone or this alone. So you need to combine both aerobic and strength training to decrease insulin resistance. Also increase your balance and stability and flexibility by stretches. So do all 4 types of exercises to improve your own compliance and your interest. Otherwise, you will feel a little bored by doing just one type. And this combination you can get in yoga. What we also found was that yoga has a higher potential as compared to traditional exercise programs in improving all these factors, as well as improving the hormones and sustaining them, and also impact on the insulin resistance and mood and emotions. Stress management, one of the best ways is to do Yog Nidra, that is yogic sleep. And one of my most favorites on YouTube is the one by Nandan Gautam, meditation of any kind and music. Just remember, as I have mentioned earlier, that even the thin PCOS will benefit from an isocaloric diet so that they do not increase weight, and exercise and stress management in the management of their own PCOS. So to summarize, PCOS is a very common condition, especially in the younger people. For diagnosis, you need 2 out of these 3 for it to be called PCOS, delayed ovulation and periods, male features, polycystic ovaries on ultrasound. It is a combination of genetic and environmental factors. Fathers too can give PCOS to their daughters. It is a metabolic syndrome associated with obesity, especially this kind of apple-shaped truncal fat, abnormal sugars, blood pressure, abnormal lipids, lower HDL, increased triglycerides. So 3 out of 5 of these parameters will define this as a metabolic syndrome. There are risks, so you need to treat, don't ignore it. There is no cure, but your symptoms are reversible, and your medicines will be according to your desires, what exactly you want to achieve. The most important management is lifestyle modifications, both for weight and for stress. So thank you all for your attention, and I am happy to take any questions.
Gurvinder ma'am, you would like to take first questions from YouTube?
All right. So one question which I think has importance for all. So is PCOS totally a lifestyle disease?
No, it's not totally a lifestyle, but the lifestyle has a very, very, very important role to play. It has a genetic bias, but I must tell you something. Recently, I took a talk on epigenetic causes of disease. Now, this concept is very important. There are genes. Now, these genes are saying you have inherited a PCOS or whatever problem you have inherited, it's because of these genes. But there are epigenetic changes or certain substances which can change how these genes behave. And those epigenetic control of these genes is in our hand, which is with lifestyle modifications. So it's not entirely lifestyle. It has genetic and environmental basis to it. But if there is a genetic basis to it, you can change it. Don't feel helpless about it.
All right. There is a question that Madam,
Neeta ma'am, please come out of that presentation so that we can see you.
I've already done. Oh,
ma'am, you need to stop presenting yourself.
Yes.
Yeah, thank you so much, ma'am. Thank you.
I missed that. Sorry about that.
Thank you, ma'am.
Yeah.
Okay. The question is, Madam, she has pain on the first day of her periods, and this is every time, so much so that sometimes she has to be hospitalized also. Would you like to say something on it, ma'am?
See, this is not a feature of polycystic ovarian syndrome, but one thing I do want to say that just a single clue that she has pain during her periods. What about the rest of her? Is she obese? Does she have abnormal hair growth? But that is just for her to think about. But I will address her pain. Her pain is dysmenorrhea, period pains. Now, period pains have very, very many different causes of it. And usually with simple painkillers, they will solve. But if it doesn't solve, then she needs to check out with her doctor, because one of the very important causes of dysmenorrhea is endometriosis, which is another disorder. Especially if her period pains continue to be there, the pain continues even at the end of her period. If that is so, then you need to check with a doctor. Otherwise, just taking normal nutrients and B6 and vitamin E, the dysmenorrhea or premenstrual syndromes generally get solved, but this is not PCOS. It's not a feature of PCOS.
All right. So I think the answer is given. There is just 2 more questions so far. Meenakshi, I'll just take them and then over to you.
Yes, ma'am.
So another question, this is not related to PCOS, but ma'am says it is always delayed and that she has to take medicines to get her periods. And second question is by somebody else who says what is the myth of eating cucumber during periods?
So I'll take the second question first. So cucumber, actually, most of the nutritionists and the endocrinologists, they advise that you eat cucumber. And the reason they do that is you have a bowl of cucumber before your meal, half an hour before your meal. The reason for that is to fill you up so that you don't eat too much. But cucumber during periods, I've never heard. I have not heard any patient telling me that she has been told by someone. I, I think our little girl here has mistaken. She must have been told, eat cucumber before every meal. So that is because it's a low calorie thing and it fills her up. Then the question about having delayed periods. So delayed periods is a feature of, but if there is a delayed period, the first thing to do is to ask, are you sexually active? If you are, don't run after PCOS. First rule out a pregnancy. If you're not sexually active, then PCOS is a very important cause, and it could be maybe she has a thyroid problem. So that is the investigation of the causes of PCOS, thyroid, diabetes, and other things.
All right, you can, Dr. Meenakshi, you can ask before I collect more questions.
There is one question I saw, which is the food to eat to keep the uterus healthy. I want to answer that. There is no food to keep the uterus healthy. The way to keep your uterus healthy is not to have an unwanted pregnancy, and not to have unnecessary sexually transmitted diseases.
There is a question like vitamin D, intake of vitamin D or deficiency of vitamin D related to PCOS.
Yes, there is adequate research to say that vitamin D, correction of vitamin D status has led to improvement of PCOS. So there is a connection between vitamin D with PCOS as well as vitamin D with several issues.
Ma'am, there are two questions. One student is asking कि every time, every month her period is delayed by 10 days. And another question is if once in a year your periods are delayed for 10 to 12 days, is that indication towards PCOS or not?
See, now this is the concept. Now you have a patient who is diagnosed as PCOS at this point of time. So this is the point of time that she has been diagnosed. But the disease did not, this syndrome did not start here. It started here, way back. So at this point of time, even though she may not have fulfilled the criteria, 2 out of 3 features for PCOS, but it began here. So even if this girl has one delayed period, and that itself should alert her. Why was it delayed? So have I put on weight in these last few days? Have I noticed a few hair? So this is the time, because it must be beginning here. So if it is beginning here, it will be diagnosed here. So don't wait for that.
Ma'am, there is one question. One girl is saying, I am having regular periods, but I have some hair on my chin. So is it related to PCOS?
Yes, it could be. It could be, because if she, out of 2 out of 3 criteria, 1 criteria is already there, abnormal male type of hair. The other criteria is that she should get an ultrasound done and check whether her ovaries are polycystic or not. And like I said, even if the ovaries are not polycystic, having little excessive hair indicates a male excess of the male hormone. So maybe she is obese. So because obese or pre-diabetic, so correct all your hormonal issues.
Okay, ma'am. Ma'am, one girl is saying that I am not overweight, I am underweight. Still, she is having irregular periods.
Yes, lean PCOS.
Okay.
Because there is 20 to 30% of PCOS who are not obese. And those people, the underlying problem is insulin resistance.
Okay, ma'am. Ma'am, one more question is on the duration of periods. Like one student is saying she is having periods only for 2 days. Is it normal?
Yes,
Duration?
yes,
Okay.
it could be normal, because it is 4 plus minus 2 days. The duration of period is 4 plus minus 2. So from 2 days to 6 days is a normal flow. So say 2 tablespoons 2 spoons up to 4 tablespoons is normal.
All right, ma'am. So, Vinda ma'am, you would like to take up any question?
Yes, there are 3 more questions. So one is there any vaccine that can help the girls that they don't have this problem in future? Like we have vaccines for other things that we can prevent. So is there a vaccine for this?
Vaccines are generally for viral infections. So, because for viral infections, if you take a vaccine, then you can improve you're protected when you have it. But this doesn't have a viral or a bacterial cause. So there is no vaccine for this, but a connected thing is vaccine for cancer cervix. So it is this age group, 9 years to 26 years is the best time to take the cancer cervix vaccine.
Would it now? This is something I am asking. Would it in any way interfere with their reproduction capability? The vaccine?
No, not at all.
All right. The second question, ma'am, is how does sleep affect PCOS?
PCOS affects the sleep.
All right.
Yes, I understand what this girl has said. See, most of us, what we are doing is we are night birds. So night birds is we are sleeping very late, and because there becomes a long gap between the dinner and the sleep time, you're hungry again and you're eating. Now, the principles of intermittent fasting and weight loss programs is that after sundown or 7 p.m. or whatever, don't eat. So when you are sleeping late, you are eating more, and your whole metabolism, like your metabolism is geared by the melatonin and the sunlight. So you have changed that. So if you have abnormal sleep patterns, I think all hormonal problems do occur more frequently.
All right. There is one case, periods, they come regularly, but after 3 months. So is it a cause of worry? Like it is regular, but only after 3 months?
No, anything which is more than 20 days is irregular.
Okay, that means another question related is twice a month, periods twice a month, but only for 6 months during the year.
Twice a month, and for 6 months she doesn't get periods.
Let me ask, because she says this is what she has said. Meenakshi, you can continue while I get some input on this question.
Yes, ma'am. One important question is there, Neecha ma'am. One student is saying her sister is 15 years of age and still not having periods. Is that normal?
Does the sister have the other sexual attributes? What are the other secondary sex characters?
She is overweight. Ma'am, she has mentioned she is overweight also. So she should decrease her weight. Maybe she is indicating she is overweight, still not having periods and 15 years of age. So
I'll tell you one thing. Like often we have looked into the question, what determines when will the first period come? So the determinant of that is actually the weight. So when a girl child reaches 35 kilograms of weight, this is a concept that we have, may not be very true, but 35 kilograms of weight, then her period is about to come. So overweight, it could be that she should have had period because she's there. But what I want to know is, what are her secondary sex characters? Does she have development of breasts? Does she have axillary hair? Does she have pubic hair? So if her other sexual characters are undeveloped, we call it sexually infantile, like a child. Then definitely after 14 years of age, you should do. But if secondary sex characters are there, then you can wait till 16 years of age, but then reduce her weight. Because
okay, ma'am.
be hypothyroid.
Yes, ma'am. When one student is saying that her periods continue to 2 weeks duration.
That is heavy period. So this answer will come that suppose 2 weeks her period has how much delay was it before it started? Was it delayed? So because
he has not mentioned.
yeah. See, if that period is delayed, like in polycystic, there's no egg release. So it's a delayed period and it is estrogen dominant. Estrogen will cause increase of thickness of the lining of the uterus. So whenever that breakthrough comes, at that point the period is bound to be very heavy. So isolated a heavy period, it has to be looked are her cycles like.
Yes, ma'am. Ma'am, usually it occurs one student is asking again and again, like if she missed period or if the periods are delayed for some time, so she is going to have heavy periods after that.
Not
One,
always, not always, because most of the people with delayed periods are estrogen dominant. So estrogen dominant people will have heavy periods. But in some people, just understand what I'm going to say. You remember that diagram I showed you about that ovary? So as it's developing, developing, developing. Now, in case as it is developing, if it is not developing well, then estrogen itself may not be produced enough. So polycystic, a small percentage of them are estrogen deficient. Those people will have scanty periods.
yes, ma'am. Ma'am, there is one question for our use of menstrual cup. Is it safe to use?
Yes,
Okay,
very hygienic and safe.
right, ma'am. Gurvinder ma'am, would you like to take up a question?
Yes, Meenakshi. Dr. Nija, there is another question. Ke, how to deal with mood swings or bouts of depression for a person having PCOS?
I think depression and mood swings is actually part of the self-image which PCOS patients have. So any problem that a patient at this young age group, whatever her problem, the problem is delayed periods or acne or hair, it's a question of self-image. I think all such people, the best cure is go out and exercise. Exercise is a very, very a good mood elevator.
I'm very glad, Dr. Nija, that you have mentioned it. And as Dr. Meenakshi knows, we have been talking about it, or especially since the last 1 year, we have been telling our girls to be, away from the screen and being engaged in something. And in fact, we are going to talk about it. I only will be taking that session, perhaps how maintaining or being close to nature, growing something in your garden can be therapeutic.
Yes.
So I'm very glad that you have also mentioned that going outdoor is really important for all kinds of issues that we might be having.
Yes.
Yes, Meenakshi.
Ma'am, two questions are there. First is a student is saying, okay, my sister is 27 years old. When she about to get her periods of the month, her skin breaks out. She got lot of pimples. Is it normal or something to worry about? I think you have already mentioned about it.
No, this is
Okay.
directly connected to the onset of periods, and this is known as menstrual acne. So sometimes in some people, the oral contraceptive pills they help. See, it's very logical. Estrogen and progesterone are there in the body at this level. The egg which was released was not fertilized. There is no pregnancy. So the estrogen progesterone levels they start falling. As they fall, in 2 to 3 days time, the period will come. So this acne which is occurring just prior to the period is connected to this falling levels of estrogen progesterone. So such girls, if they do take a course of oral contraceptive pills, it will help them.
Okay, ma'am. Okay. Ma'am, is there any duration? Sometime I think the girls take the oral contraceptive pill for a longer period of time. So, is there any limit?
No, no, there is absolutely no problem. In fact, we call them oral contraceptive pills, but they have uses far beyond providing contraception. So there is nothing embarrassing about it. We are using it like a medicine, and the girls can continue to use it. I had one patient who asked me, I've been using it now for 7 years and I'm now 35 years of age. Can I use it? So at that time, the limit for using it was 7 years. But when I did an in-depth study of it, I found there is no such thing. They can continue to use it because the benefits are far more than the risks. And anybody who's already using it at 35 years of age, they don't have to stop. Starting after 35, take the opinion of your doctor.
Right, ma'am. Ma'am, one student is asking, is there any difference between PCOS and PCOD?
PCOD was the old terminology where D stood for disease. We now know that it is not a disease, it's a syndrome. And it is a collection of abnormalities involving different organs: the ovary, the adrenals for the hair, the islets of Langerhans for the sugar, the thyroid, the prolactin. So it's a collection of different organs. Therefore, it is called now a syndrome, not a disease.
Dr. Neetu, there is a question on, I don't know what exactly it is, DEVIRY. What is, there is something, Devery.
This is a progesterone preparation. And we sometimes girls who have delayed periods, and we want, see, because delayed period, the lining of the uterus has become thick. The minute you shed it and that lining is shed, so she's at no risk of anything. So regular shedding of that lining of the uterus is important. So sometimes we give this medication for 5 days for the period to come. And sometimes girls use this same medication for preponing a period or delaying a period.
So she's asking, are there any side effects?
It depends. If you're going to use it only for 5 days, there are no side effects. But if you use it for longer time, I'm not very happy, because this is an androgenic progesterone. If you use it for very long, then this itself can cause a little hair.
All right. There is one person who is saying she has rather shared her suggestion. I used to have papaya before my periods for the past few months. It has helped me out of the problem of delayed period. Is it a myth or a fact?
I think it's a myth. Scientific things should be reproducible, and they should have some kind of a proof. So if anybody says anything, you give papaya to your sister or somebody and see if it works the same way. So it should be reproducible, and many of these have a placebo effect. 50% of our diseases are cured by placebo. Doctor says, "Aap bilkul theek ho jaoge," patient is cured. Kuch kiya to nahi, we didn't do anything. It's a placebo effect. It could be that. I have not heard of any connection.
All right. Yes, Meenakshi.
Ma'am, there is a question, I was finding it where it was. I think many people wanted to ask, ma'am, first question is, they do have lots of body ache during the periods. So what they should do on a regular basis? Like, it is very common practice that they have painkiller. So is it safe to have painkiller each and every time when they are experiencing severe pain? And secondly, one student was asking that even I couldn't, I have to lie down. I couldn't I couldn't work properly also.
Yeah. One thing that I will tell you, I always like to give analogies. You have a cramp in the leg, for example, calf muscles. How do you cure that? Now, this is the foot. If you turn your foot towards the ground, so then what happens is the calf muscles, you have contracted them. Your cramp of your calf muscles will worsen. But if you put your foot like this towards the sky and backwards towards your head, you have stretched this muscle. So when you stretch this, you have relieved the spasm. It is a spasm which has caused the pain. So same is true for dysmenorrhea and other body aches and pains. Whenever there's dysmenorrhea or period pains for that matter, the whole system gets cramped. So you can help it by taking a hot water bottle. You can, stretch it out. You stretch out your cramp. You do some stretches, do some exercise, release that cramp from that area. Drink lots and lots of water. If you need to drink a few electrolytes, balance your electrolytes. If you feel that you can take an ORS at that time. Take your vitamins. B6 in this case is important. Vitamin E is important. And check your vitamin D status. So correct your body system. And like I said earlier, go out and do some walk. One of the best ways to do it, I'm just sharing what I like to do. You put that basketball ring on your outer wall, and you just need a basketball and try and get it into that. So your very action of getting it, you have actually exercised your muscle with such fun. So don't lie down on the bed. Bed will make it worse. Just do it enough to take a hot water bottle for some time.
Right, ma'am.
Painkillers are
Ma'am,
not a problem.
usually, ma'am, students prefer to take a break instead of doing what you are prescribing. However, me and Gurvinder ma'am are constantly after them that please involve yourself, go closer to nature. Even I remember, Gurvinder ma'am, when you were suggesting that please walk on the grass. You are going to get the energy from the earth. So I hope students are going to listen. Ma'am, two myths. Students want to ask regarding two myths, whether they should wash their hair during the menstruation and whether they can have a bath also. Now, this is, however, you please carry on, but I want to say this is,
Yeah.
I mean, hygiene is the most important thing to maintain in menstruation, I guess.
I will also share one thing with them. Uh, People like to control other people, and they find different innovative ways of control. And women, they want to control them all the time. So don't have a bath on this day and don't wash your hair on this day. Don't cut your nails on a Tuesday or a Thursday. These are all mechanisms of manipulative control. Understand that. There is no scientific basis for it.
If I may add a little here, Dr. Nija, yes, definitely I understand this theory. But I also have, whatever I have read, it may also be the case ki, at that time when there was no electricity and when there was, only natural light to fall back on, maybe our ancestors these small ground rules ke chalo people will listen to it ki raat ko कंघी नहीं करनी है रात को nails नहीं काटने हैं because उस समय maybe there was a need, sometimes rituals come out of a need at that particular time which has no relevance later on. So yes, whatever these myths, we need to talk about them, and if they are not relevant we need to just give them up, but sometimes they might be still relevant. And I also want to ask one question because I discuss it with the girls in the
Ma'am, I
class.
also would like to add to your thing just a little bit. I have read a research paper because I have done research on menstrual hygiene and practices. There was a story that one woman researched lot of literature in Russia, and she got to know कि why the villagers put on restriction not to having baths during the menstruation. That maybe women are going to waste a lot of water, and there the water was scarce, like there was less water available, so they want to save water, and then there is a tradition or trend going on that don't take a bath during the menstruation because it's led to a lot of wastage of water. So I think this is, yeah.
All these reasons are very valid, but I I am very strict about this, and I'm very pro women, and I just want to say that don't listen to all this.
All right, ma'am. One question which might be of help to many girls, the food part. Uh, when we talk of the diet, so is there anything that you would like to say? Because you have already specified more fiber and more of the minerals. But if you could just specify which fruits, vegetables coming from you, it is going to matter a lot.
See, personally speaking, I feel that you should have on your plate all the colors. So when you make your plate, so just see that if you have a white curd, then you have a red vegetable, and you have a purple, um, like aubergine or bengan or whatever, but have all colors on your plate and make it complete, and don't fill it too much. And as far as the fruits, see all the brightly colored fruits and vegetables which are existent in nature, all of them have some value. The orange and the reds are all carotenoids, and the Polyphenols are there in all the spices. That is why Indian cooking. So there is have a lot of those spices. Then you have resveratrol, which you have in all the purple stuff. So you have grapes, the black grapes, and the plums. So all these things which are highly colored, and every time have something like, that you are taking green leafy. My recommendation is 2 tablespoons of green leafy every day. Now, how can you take that in certain seasons? So all the palak is available all the time. But how to do that? You freeze the rest and you have, but chutney. If you have coriander and mint and green chili chutney, 2 tablespoons of that, your folic acid requirements are complete. So, and curcumin. Now, curcumin, there's a lot of debate on the turmeric and how good we are. See, I feel that all spices have their antioxidants, including turmeric. But to think that you will get your quota of curcumin from the Indian diet or the Indian curry is not true. Because your requirement of curcumin is 1000 milligrams per day. And from the food, it is extracted only 3%. So you will get very minuscule amount. So if you ever need curcumin for any particular reason, you take a capsule of curcumin because those extracts are 95% curcumin.
All right, ma'am. Thank you. Yes,
Ma'am,
Meenakshi.
one question is there, eating chocolate is a relief in periods. What we should say on this, please?
Yeah, maybe because cacao can help all this, and you have good black chocolates also, but identify and not do it in excess. Like you don't want to go overboard and put on weight just because you're having a period. Don't feel so sorry for yourself. You're having a period, it's okay, it's part of life.
And I think we should not make it more like a very pitiable situation, ma'am, where we need sympathy of others every time.
No,
I don't think so. We
no.
should tackle our body with a strong mind and head. Ma'am, one more question. However, I think it needs more consultation directly, but she has mentioned several times. She said, "Ke my question is related to pregnancy. I have regular periods and no health issues as such. All tests are normal. I had my miscarriage 3 years ago. I'm taking medicine, Litrose and Defisto from last 5 months, and I do have lots of stress for my future. What should I do?"
Infertility is a very, very stressful thing. It is always wiser to meet up with other infertile couples and form a group and discuss your fears with them. And there are times like if you have been put on Letrose treatment, so maybe if you know the treatment for, I don't know her age, no, because it depends on how fertile she is. What is her AMH value? So if she has low fertility, then she jolly well hurry up. And if she's in her 30s, then after 35, fertility will decline. The 3 most important causes of infertility after the age of 35 is age, and age. So these are the important causes of infertility. So if her age group is that, then better to hurry up and if 6-8 months she doesn't conceive, then to go in for IVF, it doesn't matter.
Ma'am, Satvinder Jyot has mentioned again and again, I am not experiencing any kind of pain during the periods. Is it normal?
Uh, if there is no pain during periods, I feel that usually those people are anovulatory because some amount of discomfort does happen.
Yes.
So if there is no pain, it could be a clue that there is no egg release in that cycle.
Ma'am, I would like to add here. I think we can also take it as a blessing because over worrying is never going to help because abhi se agar khaskar if pregnancy is not planned, then girls should not worry कि बाकी सबको हो रहा है मुझे क्यों नहीं हो रहा. I think we should take some things as blessing. For example, I would say myself, and I have a daughter, and I never had any touchwood discomfort. I have never had. So I think there are things which are beyond medicine, and we should take some things as blessings. If everything is all right, we should not think कि हमारे साथ कोई गड़बड़ है.
Yes,
We have to have that kind of a mental attitude also.
exactly.
And I think we should avoid over analysis of our own body, no, ma'am. Every time looking at the body, sometimes they are saying, "Oh, I'm like this," or at my lower abdomen, my arms are like that, my hair are like that. They are not satisfied with their body. So I
Yes.
think stop over analyzing your own body. Love it.
Especially by comparing it with others, that becomes
Yes.
little problematic.
And
Yeah.
stop comparing yourself with the celebrities, and they are not real, they are fake. So love your body the way you are. And like Neerja ma'am is glowing, her daughter is also glowing. You met her yesterday, Dr. Parul Chawla Gupta ma'am. She is the daughter of Dr. Neerja. So we
All
are
right,
best.
all right.
Both of them are shining with the glow of positivity, spreading a good word. So this is the mantra to follow in the life, right, ma'am?
Yeah.
So I think, ma'am, we have took all the relevant questions from the meet. Now you tell from the YouTube.
I think all the questions have been taken. So, um, on behalf of the college and the Skill Development Committee, I would like to thank Dr. Neerja for having spared her time. And as Dr. Meenakshi said, you know, the whole persona, the radiating persona itself, your presence itself, ma'am, has been very pleasant. And I think this is what I was saying, that we should feel blessed whatever time of the day we can spend in the company of pleasantness. We all have our problems, and I'm really glad that you have pointed out that excess of anything is bad, and not just excess. And you, whatever you said about interconnectivity, so everything, every part within our body and our relationship outside our body, they're all interconnected. So therefore the relationship between thoughts and what we undergo. And of course, you mentioning the traditional science of India, yoga, I think we all are now by and large aware of these things, and we should try to uh, form it as a part of our daily life, whatever we can, in whatever little way we can. So once again, thank you so much, Dr. Neerja, for being with us. And
Ma'am,
uh,
only one question she has requested. This is the last question. She is
all
saying,
right.
Ria, she has missed her period only for 1 month. Is it a very big problem?
No, like I said, that missing period for 1 month, as long as you're not sexually active, because girls, it is directly connected to the stress. So maybe there was some exam there, it could be stress related. If it repeats and comes again and again, then you think about it. Otherwise, you
Right,
just
ma'am.
let it go.
Right, ma'am. Right, right. Thank you so much, ma'am. Thank you. Yes, ma'am. Gurvinder, ma'am. Sorry to
Uh,
interrupt in between.
No, it's perfectly fine. So I think we have come to an end of this wonderful session, Dr. Neerja. So thank you so much.
Yes.
And we hope to meet and have more of your knowledge sometimes in future. Thank you so much.
Thank
Thank you
you.
so much. Thank you, Gurvinder, ma'am. Thank you,
Yes,
Shabnam.
a photograph,
Yeah,
Meenakshi, we
ma'am.
missed
Yes,
it.
yes, yes.
So I
Please turn on
request,
your cameras, girls, with a big smile. No more over analysis on your body. Just smile and enjoy whatever you want to do sometimes. No? It's always like, oh, should I take this cup of tea or not? Should I eat this bite of chocolate or not? Don't do overthinking. Just enjoy the life. It is a blessing. Turn on your cameras, all of you. Then you also come. My son was also learning about PCOS. Okay, we will take a
right.
picture
All
like
right.
this.
It's very essential, I think, for
Say
boys
hi.
also to have a knowledge. I think you agree, Dr. Nirja, to
Yes, absolutely.
have a knowledge of what their
Yeah.
better half or other female members of the family are facing. They
And
would be better members of the family.
we are not here just to do beti padhao. We are here also to do beta bhi padhao.
Exactly.
Thank you, ma'am. You are like a family to us. us, and we will keep calling you again and again. Thank you so much.
And thank you all
Thank you, Shapnam.
and thank you all the participants for being there, and we look forward to having you in the other sessions as well. Thank you so much.
Thank you, Dr. Preeti, for being there. Such a wonderful support on the YouTube. Thank you, everyone. Thank you, all the student coordinators. Thank you. Bye bye. See you tomorrow.